Today we are closing these ear gauge holes, I guess they're called. And this gentleman had his ears pierced and stretched a number of years ago, and he's getting older and trying to get a better job. He's seeing that it's a little hard with these, so he's going to get this hole fixed today. What you have to do is you have to excise the skin inside the hole, because if you sew that together, it's not going to stick. But once you have a raw edge, you put it together, and the difficulty is if you just pull the edges together, sometimes you end up with this nipple at the bottom. We might have to take it through and through to get rid of this little pucker, but we'll see how it goes. First step is to cut out the skin that's lining this cleft, as you can see. Here we are, the cleft has been excised, and now we're going to put it together. And sometimes you get away with just putting it together, but I think you can see if I do that, it's going to have too pointy an ear, so we're going to have to continue the incision all the way to the edge. And that's basically done very simply by just cutting a piece out of here. Kind of hate to do this because you're making the ear smaller, but there's not a whole lot of choice here. Now we'll be able to put it together and it'll look like a round earlobe. Okay, we're done here. You can see that's closed, good shape for the earlobe. It takes about 4 months, 6 months for these scars to completely flatten out. We put a little Vaseline on the incision just to keep crusts from forming around the sutures, and he'll come back in a week to have his stitches taken out. But we won't have his final photos for about 6 months or so. That's how we do earlobes at Orange County Plastic Surgery.